I am Dr. Suresh Jain. 20th July is a World Hepatitis Day. So on that basis, we'll discuss about hepatitis B to create a generalized awareness. Now what is hepatitis B? It's a virus which enters through the body through blood and gets settled in the liver, and slowly and gradually it damages the liver. In India, around 3 to 4 crores of people are affected with this virus. Now, how this virus spreads, how it enters into the body? The main entry is through the blood, either through a blood donation, or if a patient has been injected with some kind of unsterile needles, child can get from a pregnant mother, and of course, a very important, like an HIV, it can enter through unprotected sexual intercourse. If a female or male who has been affected with hepatitis B and have a sex with an other person, that person can get hepatitis B. It doesn't spread by touching, by sharing the plates. Now, what it causes in the liver or in the body? As it enters, there are different kind of patient who can come with a presentation. Some patients, they are just going for a blood donation or health checkup, and they have been tested positive for hepatitis B. They don't know because they don't have any symptoms of it. But because they have been tested positive, they can't donate blood. And such patients are asymptomatic hepatitis B patient. Another patient is a kind of acute hepatitis B infection. Patient has a typical symptoms of jaundice, fatigue, malaise, yellow colored urine, and when they test for hepatitis B and that comes positive, they are called acute hepatitis B. Another very important part of it is chronic hepatitis B. The person has a hepatitis B virus in the body that gradually, slowly damages liver. What happens? A cell by cell get destroyed with hepatitis B virus, and as gradually destruction occurs, there is a scarring in the liver. That scarring is nothing but a fibrosis. So that part of the liver is a dead part. So that part doesn't work, and gradually whole livers get involved, and that is called a cirrhosis of liver, and that is really a dangerous situation. Now, what are the effects of it? How the patient presents? In cirrhosis of liver or a damaged liver patient, hepatitis B patient can present with ascites, like there is a water in the stomach. They come with a bloating, fullness. There can be a pedal edema, means swelling on the foot. There can be a facial swelling all over face. They can present with a hematemesis, that is called as vomiting of blood. Because of liver failure, the portal hypertension develops, and that leads to development of varices, and that presents of blood in a vomit. Some patients presents as an unconscious condition or comatose condition, that is called hepatic encephalopathy, and that is because ammonia is increased. Liver has a function to eliminate ammonia from the body. Because liver is not functioning well, ammonia rises, and that leads to mental irritability or unconscious condition or comatose condition. Many patients present as a muscle wasting, that is because of protein loss. So these all are presentations of a liver failure. What are the main functions of the liver? Very important is production of glucose, production of fatty acids that are important for digestion. Another very important, it eliminates the ammonia from the body, whichever develops in the large colon because of the waste material. The ammonia has been removed from the body by liver. And another very important is production of coagulation proteins and albumin. And what happens in liver, the coagulation proteins are very important for a clotting mechanism. and when liver gets deranged, the chances of bleeding increases because of there is a shortage of coagulation proteins. Now, what are the important care or precautions to be taken in hepatitis B patients? Now, person if he is a hepatitis B carrier who is asymptomatic, only hepatitis B viruses come positive, viral load is not very high, such patients should be observed carefully. Every 6 monthly they should undergo ultrasonography to look for any kind of liver tumor development. They should undergo viral load every yearly to know exactly whether the virus has become active or no. They must investigate themselves for liver function test every 3 monthly, where HGPT is very important, that is called ALT, because that reflects the damage of the cells. Such patients' family members should be vaccinated. Regular follow-up, regular checkup is the key for such patient. Another acute hepatitis B patient requires a supportive treatment for hepatitis B. Very important part is cirrhosis of liver. This patient should be investigated by salt, should be treated by salt restriction because salt holds water, diuretics to be given which will eliminate the water from the body. Because of this increase in ammonia, they should be given a lactulose which will clean the colon so that ammonia level will go down. The antibiotics called rifaximin should be given with their colonic antibiotic which will control the bacterial growth. Very important, such patient should undergo endoscopy. Endoscopy is a tube which goes through the mouth, sees esophagus, stomach and part of small intestine. Because of portal hypertension, there is a development of varices, and that varices can bleed, and that patient can have a life-threatening bleeding. To prevent that, it is always better to visualize the varices beforehand, and if the varices are present, do the band ligation. 4 to 5 attempts of band ligation gradually to be done every 3 monthly completely eliminates the varices, so the life-threatening situation can be taken care of. Now, investigations which are important for such patients are liver function test, proteins is very important, coagulation factors are very important, and the special test is hepatitis B viral load and E antigen. Of course, endoscopy, ultrasound, CT scan, MRI are required as per the seriousness of the patient. Now, what is the treatment in hepatitis B? We are talking about a chronic hepatitis B who is having a viral load. Should be given interferon injections. They are the most trusted treatment nowadays for hepatitis B if the viral load is very high. But simultaneously, there are oral drugs which can be given in hepatitis B. Regular checkup is important as a particular interval about liver functions, sonography, endoscopy, and vaccination plays a very important role in hepatitis B. If a person is suffering, his wife or her husband should be vaccinated. Paramedical staffs who are very prone to develop because they keep in continuous touch with blood should be vaccinated. Doctors as a profession, they come in contact with, they operate such patients, so should be vaccinated. The ideal protocol is if you start today, give another dose after 1 month and give next dose after 6 months. A child who has been born with hepatitis B, and they should be treated with immunoglobulins as well as vaccination. So care, prevention is much important in such cases. Thank you very much.